All right, let's jump right into section 1, the denture dilemma, and why it's such a common struggle.
Let's be real for a second. For so many patients, dealing with failing dental health is just a daily, exhausting struggle. Are you tired of unstable dentures and severely damaged teeth? Because so many people spend years hiding their smiles or, avoiding their absolute favorite foods at a restaurant simply because they just don't trust their teeth. If you are searching for a more permanent, reliable solution to that daily frustration, you are in the exact right place.
So enter All-on-4 implants. The core concept here is honestly pretty brilliant. It's a method that uses just 4 strategically placed implants to replace an entire upper or lower set of teeth. Think about it. Instead of the massive, overwhelming undertaking of replacing every single missing tooth with its own individual implant, this advanced technique acts sort of like a bridge. It uses 4 incredibly strong pillars to hold a permanent set of teeth securely in place.
Moving on to section 2, are you a candidate? Let's evaluate your needs.
Now, you might be wondering, is this actually for me? Well, you are likely an ideal candidate if you've lost most or all of your teeth, or if your remaining teeth are severely damaged or failing. It's also a fantastic option if you've experienced bone loss in your jaw. And crucially, it's for anyone who desperately wants a fixed alternative to removable dentures. I really want to emphasize something here. Even if you've been told in the past that you aren't a candidate for traditional implants, you might still easily qualify for this specific technique.
And here is the real game changer. Those 2 posterior or back implants, they're actually angled. Why does that matter? Well, by tilting those implants, the surgeon can maximize contact with whatever healthy bone you currently have left. This specific bit of biomechanical engineering is exactly why patients with bone loss can still find hope here. It often completely eliminates the need for invasive, painful, and honestly time-consuming bone grafting surgeries. Okay, section 3, the step-by-step procedure. Let's do a quick clinical breakdown. Knowing exactly what happens in the chair is the best way to remove the fear of the unknown. The surgery follows a really logical, carefully planned process. Step 1 is a highly detailed evaluation with 3D imaging to map out your exact bone structure. Step 2, any remaining damaged teeth are carefully extracted. Step 3 is the actual surgical placement of those 4 foundational implants right into your jawbone. Step 4 is the amazing part, the attachment of a temporary fixed set of teeth on that very same day. And finally, Step 5 happens several months later, where your permanent, highly customized prosthesis is securely placed once your jaw is completely healed.
I absolutely have to highlight this quote directly from the medical literature. This same-day teeth concept is one of the biggest advantages of this technique, and it truly is phenomenal. Imagine going to sleep under anesthesia and waking up with immediate functional and aesthetic improvement, leaving the clinic with a beautiful, fixed smile on the exact same day of your surgery. It's just incredibly encouraging and totally life-changing for patients.
Let's move to section 4, what to expect during recovery and your healing timeline. So here is the realistic timeline you're going to face. For the first few days, you should expect some manageable swelling and discomfort, and you'll be strictly on a soft diet just so your jaw can rest. But within a very short period, usually just a couple of days, most patients bounce right back to their normal daily activities. Over the next several months, the implants are going to fully integrate through this fascinating process called osseointegration. Basically, the titanium actually fuses directly with your human bone. And the ultimate payoff for all this? Decades. That is the potential lifespan of these implants, giving you a functional, gorgeous smile for the rest of your life.
But I've got to be straight with you here. While those titanium implants themselves are incredibly durable, taking personal responsibility for your oral hygiene is absolutely mandatory. To prevent infection or the outright failure of the implant, you need a quick, strict daily care routine. You must gently brush the prosthesis every single day. Use a water flosser to clean beneath the bridge. That part is crucial. Strictly follow all of your post-op instructions and never skip those routine checkups with your dentist. Maintenance is your absolute key to longevity.
Which brings us to section 5, understanding the costs and the financial investment involved.
The financial investment here is significant, usually landing between $20,000 and $40,000. Now, it's really important to understand that in the United States, this is the typical cost per arch, meaning that price is for just the top row or just the bottom row. So a full mouth restoration, doing both the upper and lower jaw, can range anywhere from $40,000 to over $80,000.
You're probably thinking, wow, why does it cost so much? Well, the final price tag depends heavily on using high-quality materials, the surgical expertise of your provider, and the specific anatomical complexity of your mouth. However, you've got to look at the big picture. By using only 4 implants to support an entire arch, you are completely eliminating the massive surgical trauma and the extreme financial cost of paying for individual implants for every single missing tooth. It is a highly efficient long-term investment in both your physical and mental well-being.
And finally, Section 6, All-on-4 versus traditional dentures. Let's compare your options side by side.
Think about traditional dentures for a second. They just rest directly on your gums, relying on suction or paste. Because of that, they can shift, they can rub, they become terribly unstable over time, and you have to take them out every single night. All-on-4, on the other hand, is a fixed, non-removable solution that is anchored directly to your skeleton. Because of this profound stability, it does not shift. You can finally bite into a crisp apple again without that terrifying fear of your teeth joining the apple on its way out. It completely eliminates the frustrating, embarrassing limitations of traditional removable dentures.
So, what does this all mean for you? Well, knowledge is the ultimate tool to overcome dental anxiety. If just 4 small implants have the power to completely rewrite the future of your physical health, your diet, and your self-confidence, what is stopping you from taking that first step today? I highly encourage you to discuss these clear insights with your dental provider. Thank you so much for learning with me today, and hey, here is to your brilliant new smile.